Welcome to the Creighton University CPHHE Mental Health Podcast. My name is Monica Lewis, and I am a mental health practitioner. I've been a practitioner for since 2006, and I enjoy what I do. I have two other co-hosts with me. Please introduce yourself and tell us about what you do.
Johnny No Good, founder of Beyond the Stigma, a Black men's mental wellness intergenerational peer support group that's been in business since 2022.
All right.
And my name is Peyton Hogan. I am a licensed mental health therapist and the owner of Bear Company Counseling. I've been practicing since 2019.
2019. Thank you. Welcome. I didn't say about my agency. My agency is Lewis Counseling and Visitation Services, and I am happy to be here. Today, our topic is on anxiety. What do we know about anxiety, guys? It is one of the most common things that people go through on a day-to-day. You know, I remember being a kid and getting up and having to talk in front of the class and my stomach flipping, doing somersaults in my stomach and stuttering, trying to get the words out and having people look at me and having to take a deep breath and people laughing and going, and having to get it together. I think that was probably my very first experience with anxiety was speaking. And look, now this is all I do.
Full circle.
Full circle moment.
You mentioned anxiety being probably one of the most common things. Well, actually, it is the most prevalent mental health illness in America. Over 40 million adults have reported struggling with anxiety symptoms. And so I think that's something that we probably should talk about. Like,
I think so.
how many people walk around day to day with anxiety and don't treat it, don't deal with it, and are just struggling.
Why do you think that is, Johnny? Why do you think people walk around every day and don't treat it and just kind of struggle with anxiety like that?
I think it got a lot to do with like what are the misconceptions around what anxiety is. And I think it goes back to our previous episode where we was talking about rumination and the feedback loops of thinking. And so y'all mentioned a lot of different aspects that I think that also apply to depression as anxiety. When y'all talked about cognitive distortions and stuff like that. And for myself, right, I didn't know I had issues with anxiety until I had a panic attack before. So I'm like, oh, wow, this is crazy. Like I real life thought I couldn't breathe, had to lick my finger, put it in front of my nose because I literally felt like I couldn't breathe. But if I didn't feel the wind coming off. So I just think it's a misconception around it. And I think we talked about before, like depression being concerned about things that already happened, and anxiety is based off of things that could be happening, future things that haven't even took place yet. So I think as, like the climate and time period that we're in, there's a lot of uncertainty about what tomorrow will bring. That's when you'll start to see the numbers of anxiety rising. So I think it's the uncertainties of the time.
Absolutely. We saw a big increase in anxiety in 2020. When we go back to 2020 during COVID, the onset of COVID, we saw a big increase.
Yeah, I think we can kind of understand that through the lens of, like you said, it's that what if thinking, it's that future uncertainty. And similar to some of the other topics that we talked about before, anxiety is normal, right? Because if we didn't have anxiety, we would never be ready for anything, right? Like if I didn't have a healthy amount of anxiety about showing up for my job in the morning, then what would get me going to even want to be there?
That part.
You know what I'm saying? Right. But it's where now my worries or my concerns are persistent. I'm constantly worrying about the next thing, and it's impeding on my day-to-day function. That's where anxiety becomes abnormal. And if we want to look at anxiety as this technical definition, anxiety is a natural human emotion characterized by feelings of tension, worried thoughts, and physical changes like increased heart rate or sweating. Like I said, while occasional anxiety is normal, that persistent anxiety is what's not normal, and it can lead to other major health conditions. I don't know if y'all have heard of like toxic stress.
Yeah.
But that's where toxic stress starts to kick in when our body is in this heightened state of like fight or flight, right?
Right.
For a long period of time. That means cortisol is constantly being released, norepinephrine, adrenaline, like those response hormones are constantly being released. Now my body is at elevated blood pressure, right? Where if I'm consistently like sitting with elevated blood pressure, what's gonna come from that?
Hypertension and stuff.
That's right.
Hypertension,
Blood pressure.
heart disease, heart
Right.
attack. Like there's a lot of health conditions that come from that. So unmanaged anxiety, that's the real problem. Not having it, but not managing it.
Not managing it.
That's the issue.
Right. Right.
Yeah.
Absolutely. Absolutely. So, and what are those for? There's fight, flight, freeze,
And
and
fawn.
fawn. Mhm.
You want to talk about those a little bit? What are those?
Go ahead.
Oh, dang, how you gonna mention them? And then go ahead. When we look at our responses, right? When we're placed in situations or in scenarios where we have to react, we have these certain response cues, right? We could fight, right? Where I'm ready, I'm on guard, and it's not always a physical fight. It could be a fight where I'm standing my ground, or like it could be a fight where I'm gonna argue back with you, or I'm gonna have something to say back, right? We have the flight where I'm running away, like I'm defenseless. I can't fight this, so I have to flee it, right? And then the other one is freeze, right? Where I'm just stuck. My mind is blank. I can't do anything. And that freeze response typically comes from being exposed to high traumatic situations at a young age, to where you were defenseless and you couldn't do anything, and you never found an out
Right.
from the trauma. You were trapped. The only thing that you could do is shut down. That's the freeze. And then go ahead, talk about fawn.
The fawn is that person that's going to be willing to do whatever you ask them to do at that moment. Just go here. Okay. Where do you want me to go? What do you want me to do? That's the fawning part. They're just trying to do whatever you're asking them to do. Not really thinking about it, just doing. Just moving around and just doing it. So I think we oftentimes don't even really think so much about fawn as much as we do the other ones. So that's going to be that person at the scene that's just trying to, call 911, call do this, do that. They're going to be that person that runs and does all those little things and just kind of in motion. And not really thinking about anything else.
Yeah. So I know previously on our other episode, we mentioned like the link between depression and PTSD. Are there any connections or correlations between anxiety and PTSD, and how has past trauma or past traumatic situations kind of lead us to being in a state of being overly anxious or experiencing anxiety about what's to come?
100% correlation, 100%, right? Like when we look at the symptomology of PTSD, the same symptomology of anxiety, and we're not gonna get super deep into that.
Right.
They intersect. PTSD, of course, has a couple other things that are not mentioned with anxiety, which helps to distinguish the two diagnoses.
Right.
But one of the major ones is going to be like hypervigilance, right? I'm always like aware of my surroundings. When we look at the life of someone like me, right, like a Black man, like it's easy to become hypervigilant with a lot of the traumas that we have experienced, right? And we don't even realize it. There's a heightened state of anxiety that we're constantly functioning from. And we think it's natural.
That part.
Which is why a lot of us don't even realize we struggle with anxiety. Like you were mentioning, you didn't even know you had anxiety until you started to experience a panic attack. But the fact that you even knew you were having a panic attack is wild, because I've talked to some of my clients and to other individuals where it was like, when I get in crowded spaces, like I just feel uncomfortable and I don't want to be there. So I don't like being in crowded spaces. But then when I'm like, bro, you got anxiety, you were having a panic. Nah, it ain't anxiety. Like I just don't trust that space. And it's like, no, you literally are explaining textbook anxiety in that moment. So I think for a lot of people, not just Black people, but I think for a lot of people, they don't have the terminology or even the mental dictionary to understand what it is that they're going through. And that's with so many emotions, even outside of being anxious or having anxiety. Like we just never even knew what word to put to the experience that we were having.
A lot of times ERs are flooded with people who have had panic attacks because they don't know that they've had panic attacks. Because, like you said, it feels like you're dying. It feels like your heart's about to stop, like
Yeah.
you can't breathe.
Yeah.
So all they know is that they can't breathe. They're suffocating. So where do you go?
That part.
You go to the ER. And when they get that diagnosis that they just had a panic attack or they're, you have anxiety. You had an anxiety attack. What is that? What do you mean? How come? No, that's not what it is. Something is wrong with me. And when they really, really get that information and we break it down for them to have them understand, it's kind of like an aha moment. Then they can go back and realize, well, dang, you know what? I have been having some moments when I have been kind of fearful. I have been questioning a lot of things. I've had a lot of persistent worry that has been bothering me from time to time. And I mean, things have been unsettling. I'm not for sure if I'm going to be able to keep my house or keep my car or keep my job or if the person that's in the hospital is going to make it. And all of those things that we think are just normal things that we go through every day. All of that uncertainty can definitely trigger some anxious moments,
Definitely.
And when it begins to impede in a person's day-to-day, that's when it's a problem.
That part. And I know you got experience as a drug and alcohol counselor and stuff like that. And I know like a lot of times, right, because we don't want to throw out there correlation like that means causation, but do you see like an increase in like reported anxiety amongst people who tend to use alternate substances that kind of alter the mind state?
Absolutely. And I'm sure you can agree with me. I have a lot of patients that have anxiety disorder that smoke marijuana because it tends to calm them down. And they would much rather smoke their marijuana than take medication because it's helped them. And this is what they've done since they were 16 years old. But I will tell you this, working with people who have had traumatic experiences or have had incidences where they had experienced anxiety early on in their childhood and it has carried on into their adulthood and they have learned to self-medicate with marijuana by going back to those moments that have, and working through those moments that had triggered their anxiety and finding out, okay, what's happening? What do we have going on? What do we have going on now? What did we have going on then? What were you doing then? I know what you're doing now, but working through that actually has helped them to kind of back up from the marijuana use during the times when they're feeling uncertain. They can recognize what they can do. Okay, well, what else could be doing right now? Reality test a little bit. This is how I'm feeling, but just because there's a difference between how you feel and what's real.
That part.
And so being able to break that down for them helps them a lot because sometimes we get stuck in our mode because we're kind of creatures of habit. We're used to doing something that helps us, right? Well, I know that it works, so why would I stop? If it ain't broke, don't fix it, right? But if there's a better way, why not try?
I think something that I've noticed with individuals who will self-medicate with marijuana when they're struggling with anxiety is it actually heightens the anxiety. Because one of the side effects of marijuana is it increases your heart rate. And so people who are struggling with anxiety, while at certain points in their life, it mellowed them out. When they start to struggle with that anxiety, they now are having like panic attack on top of panic attack on top of panic attack. But they're so dependent on the ritual of smoking weed and the mindset shift that it brings to you, right? Because it's a psychoactive substance and it takes you out of your normal state of mind. That it's hard to say that it's hard for an individual to say, nah, this is what's causing the panic attack. They're like, no, if I didn't have this, then I would be experiencing a panic attack. And I've worked with multiple clients who have came in and told me like, yeah, I can't stop the panic attacks, man. If I don't smoke, then it's like, and I'm like, well, maybe that is actually causing it. And studies have shown that excessive marijuana use, especially when you're struggling with mental illness, can, and it increases the likelihood of you experiencing a state of psychosis from it. And that's something that's not talked about. And a lot of people don't believe it and they don't like to say it, right? Like if you're utilizing this psychoactive substance, which means it is changing and altering some form of your brain's anatomy, right? If you use this enough, it can do something, it can crack you pretty much. And so people need to be aware of that.
I think
Especially during high stressful moments. I'm sorry, John.
no worries. I think it bring me back to a conversation that we had before previously where I talked about how I stopped smoking marijuana and kind of some of the symptoms I was experiencing and how marijuana, the use of it kind of can replicate symptoms of depression and symptoms of anxiety. And so I think it's definitely important for people who do choose to self-medicate like that to be cognizant of their mental health and where they're at, because if you're experiencing anxiety, you probably don't need to be on no sativas. And if you're experiencing depression, you probably don't need to be on no indicas. So making sure that you are self-medicating with a proper strain that can counterbalance whatever it is that you might be going through. So it reminded me of that conversation. But I've been over a year off of marijuana now, one of the best decisions that I made in my life. And I don't constantly put myself into the re-traumatization or reenacting the same symptoms of being anxiety. I don't have the issues with the heart rate. I don't have the issues with being as depressed or feeling as down. And I did truly believe in, and I would have fought you for it. Like, I never thought I was going to stop smoking. I would have fought you for it. I told, hey, listen, bury me with a 7. You get what I'm saying? But I never would have thought that I would stop smoking. But I have seen the benefits and a surplus in my mental health because of it. So I do think for a lot of us who do or who have medicated in the past with marijuana, we do refuse to believe that it is a psychoactive drug that does have side effects that can be detrimental to our mental health.
Absolutely. Absolutely. And that's what I meant when I said I know what happened before. I know what happened before. And I know what happened now.
Yeah.
But what if? But what if? So yeah, that makes sense. What if you let it go? Because if you let it go, you might see that there's things that can happen a lot different and a lot better for you without you having to use marijuana.
That part.
And with you managing it.
That part. So kind of like for people who are like me, who might be struggling or have struggled with anxiety, what are some of the tools or some of the tricks from the toolkit that they can use in real life application? Maybe they don't feel like going to see a therapist, or what are some of the strategies and tools that they can use to kind of help deal with this very, very common mental illness?
Go ahead.
No, ladies first. Ladies first. You got it.
I always go to deep breathing.
Okay.
You know, that is my go-to. I've worked with people for many, 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 many years and seen all kinds of different anxiety disorders, even to the point where you can have temporary paralysis from anxiety, you know. But one of the things that I have found to be the most calming is just resetting the body. You know, just the good old deep breathing. You're taking it in, holding your breath for a few seconds, slowly letting that air out, and just resetting your body. Because what happens when we hold our breath? What does that do? It makes our body have to it slows our heart rate down, right? It makes the body have to completely reset itself. So if it's completely resetting itself, then what's going to happen if you're trying to have an anxiety attack? Heart's racing, and it's going to slow that heart rate down. But I can't breathe, and you want me to hold my breath? Yes, but you really can breathe. And by holding your breath, you're going to recognize you have breath, and slowly it begins to reset. Now, does it happen just like this? No. A couple times, doing it 2-3 times, and next thing you know, you're back to being calm, you're feeling great, and you can move forward, you know. Deep breathing is not only good just for anxiety, but it's just good even when you're stressed, period. You know, if you're experiencing brain fog, if you're feeling overwhelmed. What was you going to say, Peyton?
Yeah, no, I agree with everything that you were saying. To kind of build off of that, I would take it back a little bit, and I would say, if you don't want to go to a therapist and deal with your anxiety, I would encourage you still go to a therapist.
That part.
So you can at least understand what's going on, because there's many different types of anxiety.
Absolutely.
There's social anxiety, where you have anxiety when you're around other people. There's generalized anxiety, where your anxiety is just present and it doesn't matter the situation. There's agoraphobia, where you have fear of like not being able to get out of spaces and places. There's selective mutism, where you like just can't talk when people are like in social interactions, like you don't speak. There's panic disorders, where you will randomly just have panic. Well, it's not random, but it feels like they're random panic attacks at times. So I think it's important that you go speak with the therapist first to get a diagnosis. And a diagnosis is not something that you have to wear like on you, like I am I am depression. I like, you don't know it, but I look at it like this: if you got a car, you're not gonna drive a car around that's making this noise and just be like, oh, like my car's just making noise. When you hear the noise, you're gonna take your car into the shop because you want to know what's wrong with it. Because if you don't know what's wrong with it, then you never can get it fixed. And if it ever breaks down, you just stuck with a broken car. I believe it's the same thing. If we're experiencing these symptoms, we should know what we're dealing with, right? And being able to understand that diagnosis, you now can equip yourself properly to be able to handle what's at hand. And so I think that's the first step. But then again, piggybacking off of what you said, I think really utilizing a lot of DBT skills, which DBT is dialectical behavioral therapy. And it's all about when I'm experiencing these intense emotions, how can I bring my emotions from a 10 down to a 5? Not get rid of them, because ain't no such thing as getting rid of our emotional experience. No such thing as getting rid of anxiety. So don't think you're gonna get rid of your anxiety, but you can regulate and manage it, right? So doing things like deep breathing, learning different grounding techniques, and really becoming aware of your body, right? Because when we're in a heightened state or an anxious state, I'm not aware of anything except for this heart beating. I can't breathe, like I'm about to die. And it's like, well, what if I actually like put my feet on the ground and felt my feet on the ground for a second? And I started to focus on that. And I took my focus off of I'm about to die. You know what I'm saying? What if instead of focusing on this panic attack I had, right, I started envisioning something that brought me back to a state of peace or a place where I had the most enjoyment, right? The cure for anxiety is taking ourselves out of this present moment and placing us in an intentional different experience, right? If I can do that, I can start to curb the anxious symptoms.
Yeah, I love that. And I love the fact that you broke down that there's different levels to anxiety. In our previous episode, we talked about the different levels of depression, but there are different levels of anxiety, panic disorders. You talked about phobias. You talk about generalized anxiety. You talk about social anxiety. And I think that what you was hinting to earlier, Monica, was that since COVID, we've seen a rise in social anxiety. So it's something that's more prevalent. And I think you mentioned before, Brother Peyton, that 40 million Americans deal with anxiety as one of their ailments. So it's something that's very, very normalized. What else in the realm of anxiety? Like, is there anything that we missing? And is there something else that we should be exploring within this topic?
I think that, we looked at some of the major things that we would really want people to know and be aware of. I think with agoraphobia, at times people don't even recognize that it started at first, because they'll get to the door and then just suddenly say, I don't want to go anywhere. And after a while, they'll get to the door and find themselves just unable to walk out of it, like stuck, like almost like there's an invisible wall when they open the door. Even though they can walk through, it's almost like there's an invisible wall blocking them from going. And that can be traumatizing even for them, because they don't know why they're experiencing that. And so by being able to go and talk to a trained professional, I think it's important, because then we can process that out with them to figure out where that's coming from and to help them through it. Anxiety is something that is manageable. Is there a point where you're no longer going to have panic attacks? Can you get to that point? Absolutely. Is anxiety just going to just overnight go away? Not necessarily, because we have to remember that anxiety is something that we're It's normal. We're supposed to have it.
Mm.
It's our early warning sign, even for danger.
That
You know
part.
what I mean?
Mhm.
So there's healthy anxiety. So we wouldn't want to get rid of it.
Mhm.
We just want to make sure it's not impeding on our ability to live our daily life.
That
And
part.
so by understanding those aspects of it, the unhealthy aspects of anxiety helps a person to be able to move forward. And Peyton, I think you did an excellent job explaining that and giving the statistics for that. So
Yeah.
I think we covered it.
Thank you. So I guess before we get out of here, are there any like triggers that people should be mindful? And mind you, triggers are going to be different for different people. What are some of the most common triggers that can help trigger an episode of anxiety into somebody so that they can be mindful in knowing when they should or should not be seeking help from a professional, so that y'all can help them navigate that and get some management techniques?
Yeah, I think your triggers are going to be person to person because it's very situational. I think just like with many of the mental health diagnoses, whatever type of big or little trauma that you experience is going to start to determine like what those triggers are and how you start to become like provoked into an anxious state. What I would encourage people to be aware of though is pay attention to the cues that you have when you are triggered. And those cues are going to be the physical responses that your body starts to give. For a lot of people, right, they'll say, I start to feel like this churning in my stomach, or like their face becomes hot. You might feel pressure in a certain part of your body. If you're able to become aware of your cues when you're experiencing some type of heightened emotional state that's unpleasant, you then have a better chance of potentially being able to stop it from getting to like an extreme level, like through practicing things like mindfulness, deep breathing, grounding techniques, all of that. So
yeah, excellent. So I think we pretty much covered everything. We talked about anxiety, what it is, how common it is, kind of why we should be seeking professional help with managing it. I think even in our very first episode, we talked about with certain mental illnesses, the illness itself is not who we are. So don't identify with the illness. So I love the fact that you broke down that anxiety is something that can be managed, but it's not something that has to become your identity.
Right.
We talked about triggers. We talked about even some strategies with grounding and deep breathing that can kind of help us navigate those situations as we're dealing with it, because it is something that's pretty prevalent. So before we get up out of here, is there any other things we should cover with this, or we out of here?
I got one other thing. If you got something else that you wanted to add? One other thing. I believe that with any anxiety, it's going to be super healthy if and when you're able to get to a place of being able to practice some sort of exposure therapy. So exposing yourself to the things that you hold anxiety to, or you hold a space for anxiety to control. But on the flip side of that, I don't believe that when it comes to situations where you were the victim of some type of traumatic experience. So if you have anxiety because you were the victim of abuse, if you have anxiety because you were the victim of some type of extreme violence, you know what I'm saying? I don't believe that you need to put yourself back in that situation in order to overcome that anxiety. I think there are other ways that you can start to process through your anxieties, but you don't necessarily need to directly face that because that can be re-traumatizing yourself over and over again. If you are able to get to a place of that through deep work and self-work, and I think a lot of internal and external forgiveness, if you're able to make it to that place, do it. But I don't believe like being exposed and re-traumatizing yourself is absolutely necessary in those type of situations.
Man, well said. So I think that'll be a wrap for the podcast today. I love the fact that you brought up that exposure therapy does not work in all situations when it comes to anxiety. So being very mindful of that. So yeah. Man, again, listen, man, I think that the people are they're blessed. It's a treat to have two licensed professionals in this space that's normalizing some of these stigmas and the misconceptions around these mental illnesses. So thank y'all again. Thank you for bringing up that we should not only be aware of triggers, but be aware of cues. Thank you for bringing up that we should be grounding and that we should be very, very mindful of how there's different levels of anxiety. So with that being said, I'm Johnny No Good.
I'm Monica Lewis.
And I'm Peyton Hogan.
We're out.
Peace.